Median nerve here first. So like always, she doesn't get across her leg is straight, she gets no pillows, everything's straight, and I ask, you got anything going on? No. Okay. So, I'm bringing her arm up. And I start with the arm just because it lets me get in here next to her. But I did change something, so I got to ask, anything going on? Then I like to do scapular depression, and I like to push it down and then plant my hand down on the table. So I keep that pressure. Scapular depression is very sensitizing to the nervous system, and so is pulling hair. So just realize that sometimes that may be enough to set somebody off if it's really irritable. All right, anything there? Look at that. I couldn't have planned that better. Am I done? Didn't I change a distal component when I did this and she got pulling from her elbow to her finger? Technically, I'm done. Now, what I should do is say, anything here? Anything with that? Comes on a little bit, off a little bit. There, I'm done. Look how nice that was. I go check that side, but anyway, I'm not going to pull this down, but I would pull that down. Now, since I'm doing median, I need to get a hold of her thumb and her index finger and middle finger. So I like to kind of grab them like this, and I can kind of get her thumb out and control things. So I do this, but I'm not going to. Then I can bring her arm down like this. Anything. I can do her wrist. Anything. And then I can start to straighten this out. She did something. See? That's why you keep your eye on it. What? Holes in your palm. So then I got to do something. If I had this, I would let that off because I like that because it's easy. But I could have her move her head side to side, whatever, right? Something just so I could change that. Can't really change the elbow or the wrist or the hand. Okay, so that's how I would do the median nerve. And of course, I would check the other side. Now, if I would do an ulnar nerve, I'm going to catch and I'm going to get her pinky and ring finger because that's where the ulnar nerve goes. So, bring the arm up. And I'm really not doing too much to the wrist yet, and ask her if she has any. Do scapular depression, ask, and then I'm going to bring her hand down, and then I'm going to pronate there, and then I'm going to catch her wrist, and then something happened, see? That's why you got to watch what's happening. She makes a face, and then I know something's going on.
Pulling in my arm.
Pulling in her arm. Where? Up there. Okay. So then I could let off the fingers a little bit, right? Does that change it? Or I could have done the head again. That would all be fine. Okay, so that will be ulnar and median. And again, I should compare to the other side. Because what if it's exactly the same on that side? It pulls in the same spot, at the same intensity, in the same range of motion, doesn't reproduce her signs or symptoms. Do I care? I don't know, maybe. Kind of depends on the whole patient presentation, but sometimes people are a little more nervy than others, and you just tension the nerves, and they're going to feel something. That's perfectly normal. So you got to put the whole picture there. Then radial nerve. A lot of times, I think in the book they kind of show them at an angle and to use their hip to catch and do the scapular depression. This is where I vary it. I just use my hand, and I can push it down. Now again, I'm not going to push hard on her because of the problem, but I push it down like that. So, and in this case, I'm doing it, but let me have her. I would ask her before I start anything, and I'd bring her elbow up. Now the radial nerve should be in a slacking position here, right? So I should be okay. Then I'm going to flex her wrist and tuck her thumb in there and see if that did anything. All right. Then I push this down and I would see if that did anything. Now I'm going to let off. Then I would bring her elbow out straight, anything, and then I would add my inner rotation. It doesn't matter. The book is probably going to say do it in a different sequence. As long as you're doing component by component, asking what they're doing, what's changing, what's going on. Then when something is provoked, changing something far away, that's perfectly acceptable. So that's just how I like to do it because, I don't know, I feel like I can control her arm well enough. If you want to use the hip on her shoulder and then use both arms to do this, perfectly fine. So I want you to practice ulnar, median,